My name is Mark Constantine. I'm the president and CEO of the Richmond Memorial Health Foundation. In 2016, our trustees made the decision to keep our focus on access to healthcare to marginalized and low-wealth populations, but to actually apply a deeper equity lens to all that we do.
My name is Reggie Gordon. I'm a trustee with the Richmond Memorial Health Foundation, and I am the director of the Office of Community Wealth Building for the City of Richmond.
My name is Dr. Vanessa Walker-Harris, and I'm a trustee with Richmond Memorial Health Foundation. And at the Virginia Department of Health, I serve as the director of the Office of Family Health Services.
Well, I'm Dr. William Nelson. I'm a physician by training. I'm now retired from the health department, where I worked for 30 years in public health. I'm now a trustee of the Richmond Memorial Health Foundation, which for me is thrilling because the foundation is doing work that we really couldn't get done in public health. It's just a very exciting time to be in this kind of community medicine.
Richmond, unfortunately, has a 25.5% poverty rate. And what that means is we have huge segments of Richmonders who are struggling to find a coherent pathway toward economic stability.
VCU has done tremendous research here that shows that your zip code definitely determines your life expectancy. So in east end of Henrico, there can be a gap of 10 to 20 years as compared to west end of Henrico.
A 20-year difference in life expectancy based on your zip code is unacceptable for our community.
The time that folks spend in their physician's office really only contributes 10% to their actual health, and the rest of it is impacted by their community, their environment, their social relationships, access to transportation, clean water, clean air, all of those things that a physician alone can't impact.
You know, there are physical determinants of health. Your DNA, your heredity, your weight, and luck, but the social determinants are things that really affect your health very deeply.
You can prescribe medication for a patient. You can advise them to eat healthier, to exercise, but if they're living in environments that are unsafe, or if they don't have access to healthy foods through their corner store or their grocery store, they're not going to be able to make good on those recommendations regardless of their will or their education or understanding of the recommendations.
Moving forward, we can either get down to the roots of what cause concentrations of wealth as well as concentrations of poverty, or those dynamics will just play out in different parts of town in the way that they have for the last, 50 years as well as centuries.
So we issued a request for proposals, a call for 18 Equity and Health Fellows from across the Richmond region, representing the diversity of the people who do the work in our place. So I'm delighted that we have medical directors and homeless providers. We have folks who work in community development and policy and advocacy. And these 18 remarkable folks have been charged with helping the foundation chart its equity agenda for the next 5 years.
The Equity Fellowship that I'm a part of is brilliant, I believe, and I'm very grateful for the opportunity to be surrounded by so many great people who think very differently, yet we think collectively about an issue that is important to all of us.
I think we all realize in healthcare now that it's going to truly take a village to really solve our health equity issues.
I felt really drawn to apply for the fellowship for two reasons. One, the kind of community and trust it would build amongst the fellows. I see that as really critical to collaboration across the nonprofit world to address a lot of the systematic roots that are causing poverty, causing poor health And then out of it, what I'm hoping comes is not just that group of 18, but ideally recommendation for how to build collaboration amongst both funders and amongst nonprofits and amongst the private and government sectors as well.
So for me, a more equitable Richmond looks like a place where there's mutual understanding. So where communities are coming together around this idea that there are mutual opportunities, mutual trust, mutual relationships. So the barriers that we think about daily, like transportation issues, income issues, race, ethnicity disparities, but then for me, the language piece is also in there, immigration status is also in there, these other barriers that may not be thought of as often.
So often we think of foundations and philanthropy as check writing, and check writing is really important for the organizations that we invest in. It allows them to keep their doors open and do their mission. But we can do a lot more, and we can help bring people in relationship together who may or may not have known each other to imagine new possibilities.
Here's an opportunity to put our arms around the issue, identify the issue, and if you're talking about equity in health, bring all the representatives of this health population to the table, and let's talk about what some of those solutions are.
We need solutions in the arena of transportation and housing and education.
All those things that help you be healthier and create the whole person that lives better and lives longer just aren't available to everybody.
And so it requires collaboration and partnership, innovative thinking and strategies, and how to leverage work in one area to the benefit of work in another area.
Because you'll never be able to fund your way to health equity. But we can convene groups together to give us a bigger voice.
No matter the place that you live,
What you look like, what religion you practice, what your sexual orientation is, all those things.
that you can become the person that you're intended to become. The doors are not closed to you because of the color of your skin, your sexual identity, or your gender.
Everyone receives the same level of care every and each time that they seek it. You're not going to have all 800,000 to 1 million people in the region at the table at the same time, you know. So you're going to have a select group of people, of course. How do we communicate that this is what it is, you know, this is how we want to change the model, the way we deliver health in an equitable fashion. While I don't know the answer, I do know it does take effort, it does take determination, it takes resolve that I know this is right and I'm going to keep pushing for it until one day we realize we're there.